The topic today is healthcare investing in a change environment. And I'll start by talking a little bit about the national environment. And to say that it is fluid is probably the understatement. There has been a lot of change in this environment. There's fiscal pressure, there's legislation, and then what happens after the legislation is reams of regulation that ends up changing the rules of the road really for every company in the space. And when you think about reform, there are basically three phases of reform that are important to think about. First is that really, kind of reform passes, the first effects of reform are really about reducing margins for a lot of the players in the space. There were taxes. There were just straight out reductions in payment to managed care companies and to pharmaceutical companies. And there really was a tremendous amount of margin pressure that was introduced into the space. And that was really the first piece and the piece that operates between 2010 and 2012. Going between 2012 and 2014, you move into a new phase where the idea is to transfer risk from the government and from payers down to providers. And you see this with these ideas that the government is experimenting with, like accountable care organizations. Again, here the idea is to take the responsibility for reducing costs and move that down to the individuals who are really able to reduce costs by interacting with patients. The coverage expansions under the new law, under the reform law, don't come until 2014. And so, the biggest cost effects are really expansions in two areas. One is Medicaid, which is the program that is designed to help mostly impoverished Americans afford health care. And if you think about 15 million new lives in that system, we're going to get back to that as an investment opportunity. And then the second is in these new exchanges that are supposed to come to the market. And the exchanges are really about taking people who don't have insurance, putting a mandate on them, and asking them to purchase insurance. So in a nutshell, that's reform. Three phases. First is margin compression. Second is transfer of risk down to providers. And the third is the coverage expansion. Now, when you think about reform, another important point from an investment standpoint is that reform is not just a national concept. It is a very importantly regional concept. Healthcare is local, and healthcare is applied locally, and healthcare is different in the local situation. And it's because providers are different, patients are different, the needs of healthcare populations are different. And in fact, even reform, which is always discussed as a national context, is really very regional. So this slide shows some of the expansion in population that will result from the Medicaid provisions of the law. And when you bring Medicaid from its present level up to 133% of poverty, you see that there are really very dramatic differences in the expansion of populations by state. So Texas, for example, a 45% increase in the number of people who are going to be in the Medicaid program in Texas. That's a massive expansion. That's a great opportunity for companies that are in that space. By contrast, Massachusetts, that basically had all of their people under 133% of poverty already insured, virtually no expansion. And so you have to kind of figure out where you are. And if that isn't difficult enough, there are also differences in how the states are actually positioning around the law. So you can look at a map of the United States and figure out where are the Republican governors and where are the Democratic governors, and pretty much predict whether they are resisting implementation or going forward with the implementation of the law. And here you see three states, Alaska, Virginia, and Maine, each of which is taking a very different approach. So in thinking about healthcare investing, you also have to be thinking about the context. Now, I would be remiss if I didn't say a little bit about the bigger companies in the space, even though when I talk about the opportunities, it's not going to be framed up that way for reasons that I will explain. But reform does have a profound effect, and the environment generally has a profound effect on all healthcare businesses that are operating in the space. And as I teed it up in the beginning, there's margin compression, and then there's expansion. So when the companies decided to support reform, they really did it knowing that they would have their margins cut but hoping that the coverage expansions would come to fruition. Now, we're in a period of time right now politically where we don't know if that's going to happen or not. And in fact, there's a fair amount of doubt right now about how reform will actually be implemented. So pharmaceutical manufacturers, the first category here, again, the tax is real. They're paying it this year. Whether there is a 30 million increase in the number of people who have insurance is speculative, and that's something that we'll all have to see whether or not that comes to fruition. So prices coming down, volume should go up, and that will all play out. By the way, nobody is talking about repealing the tax increase that came along with the health reform legislation. Health plans is very interesting. The health plans were completely walloped in the run-up to reform. I think that there was a lot of concern that in my view was greatly overblown during that time, and really analysts saying, we don't know if there's really even going to be a business model. And there was, frankly, a bit of hysteria about the government's entry into these markets. Well, these things kind of have a cycle, and now from the lows, the managed care stocks are back about 30%, and most analysts are now saying that there's going to be another 20 or so % increase. So we're in the second part of that cycle, if you will. But, the health plans, and I think this is important because, I'll get back to it when we talk about costs. The health plans are probably best positioned to manage the cost of care. And in fact, if you look at what's really happening right now, it's that we have difficulty managing the cost of care. So who's going to do that? I'll leave you with that question. You can kind of ponder that while we talk. Now, the providers, again, it's the same deal. I'm going to reduce your rates, but I'm going to give you more insured. And the rate reductions, though, are phased out a little bit. Providers are under a lot of pressure right now, and this is the hospitals, managed care, and the like. And it's hard to see where that pressure will let up. And in point of fact, I think that kind of leads to some of the conclusions that we've come to, which I think nicely mirror where John is, which is that the opportunities are really about the management of healthcare on a going forward basis. I mentioned before that there are some companies that are better positioned than others. You look at the group of companies that are serving managed care and serving states, and again, you can characterize which states they are in, and you can look at the volume expansion, and we've modeled a lot of this. And you can, again, apply that modeling back to analyze companies that are in the space to see how the expansion in population will actually affect them. So with those as some introductory comments, I'd like now to move into 4 investment theses that we think are interesting and really kind of perhaps kind of answer the question, well, given all the change and given all the uncertainty and given the massive pressures of costs and given the need to manage healthcare better, what are the opportunities in light of a lot of this pressure? And I'll go through 4. The first is data. And data is necessary to change the system. Right now, data are held in silos. Data are held by the wrong people. The ownership of the data, if you think about it, is really in the wrong hands. So, my primary care physician, who, by the way, writes everything by hand, has a stack of documents on me that sit within his office. That really limits my ability to either access the information, give it to another provider, or frankly, change providers if I felt that was necessary, because he has an encyclopedic memory, and the guy just kind of cycles back and puts his finger down on the page. And so what this has done essentially is disenfranchised me as a consumer in terms of my ability to move within the system. And likewise, it also prevents meaningful analytic work on my records. And so, you look at a situation like this, and the ability to manage care is very importantly contingent on data and data expansion. And we have a group of about 10 people who focus on nothing but how health IT is emerging in the healthcare system. And it's been slow. I mean, make no mistake about it, the complexity of the system has really prevented a lot of meaningful action. But there is a lot of opportunity that sits within that, and especially for companies that are targeted on pieces of this that can actually get implemented reasonably.